Hello guys, I'm Dr. Navneet, your faculty of pharmacology. Today we are going with the rapid revision of pharmacology. Now, I've designed this workbook in such a way that you'll be able to understand the basics as well as clear most of the questions that are asked in the exam. So, please try to follow this sequence as I've tried to keep the autonomic nervous system in the front because the understanding of autonomic nervous system is important for the FMG exams. So, before starting this autonomic nervous system, I've also kept an introduction part where you get the basic concepts that are required for this entire pharma class. If you're very good in pharmacology, you can skip this, but I strongly suggest you that you go through this so that you'll have the flow of the class and you'll be able to understand much better. Yes, so let us start with the introduction. Now, in the introduction part, all of you know what is pharmacology. Pharmacology is study of drugs. And what do you study in pharmacology? You study the mechanism of action, their uses, side effects, and contraindications. Now, how can you give these drugs into the body? Yes, there are two ways. One is systemic, the other one is local or topical. Local or topical. So, what is local way? Example, you're applying an ointment, that is local. The other one is systemic. Systemic means it should go into the systemic circulation. So if it has to go into the systemic circulation, there are two ways. One is enteral, the other one is parenteral. So what do you mean by enteral? Enteral meaning it goes into the gastrointestinal tract. Parenteral means it also goes into the systemic circulation, but it does not enter the gastrointestinal system. This is what I want you to understand. Now, in the enteral, how can you reach the GIT? There are two openings. One is oral, the other one is rectal. How about parenteral? How can you reach the systemic circulation directly without entering the GIT? Obviously via injections. So all of you know these injections. You must be very good at these. IM, IV, intradermal, subcutaneous, these are the types of injections that you get. Now, if you understood this much, what is the most common route of drug administration? Yes, it is oral. Obviously, oral is the most common route of drug administration. Now, let us try to see what will happen in the body when you give a drug orally. We'll try to start with an example. So, let us check your knowledge in medicine. Yes, let us suppose a person is having hypertension from very long, and he started developing these episodes of anxiety. In anxiety, what do you see? His heart rate is elevated. You tend to see palpitations and there are tremors in the patient because of skeletal muscle contraction. So, a person is having hypertension with anxiety. What is the best drug that you can give in this patient? Best drug as in drug of choice. So, what is the best drug for this patient? Obviously, it is propranolol. It is propranolol. So you try to give the propranolol, it is given orally. Yes. So we'll try to understand now. If we are giving propranolol in this person who is having hypertension with anxiety, what is going to happen? So let us see here. First, the drug goes into the mouth, then it goes into the pharynx, then it reaches esophagus. From the esophagus, it goes into the stomach and small intestine. But most of the absorption happens in small intestine and stomach. Now, mostly in small intestine. Why? You must have studied in anatomy. Most of the food is absorbed through small intestine, especially in the duodenum. Why? Because of presence of microvilli. So, this is the same reason why the drugs are mostly absorbed in the duodenum, because of increased surface area. So, this drug is absorbed from the small intestine into the systemic circulation. What is happening? There is absorption. So we call this absorption. Obvious. Now let me ask you a simple question. If I want to increase the absorption of propranolol, what should I do? Should I make the drug lipid soluble or water soluble? Should I make the drug lipid soluble or water soluble? Simple question, only two options. What is the answer? Lipid or water soluble? Now, this is where most people get confused. Let us try to see this with the help of common sense. Yes, so you can see here, the drug has to cross the membrane of small intestine. Now, obviously, the small intestine is made up of cells, isn't it? So, this is the small intestine, it is made up of cells. I am saying the drug has to cross this cell, so it has to cross the cell membrane. Do you accept? All the cells are made up of cell membranes. Now, cell membranes are phospholipid bilayer, with proteins in it. So, if it has to cross the lipid layer, the drug should be soluble in lipid layer, yes or no? So, you want to make the drug lipid soluble, that's all. So, to increase the absorption, you want to make the drug lipid soluble, then the drug will be absorbed very well into the systemic circulation. Did you understand this much? So, once the drug is in the systemic circulation, what will happen? What is the function of systemic circulation? It will distribute blood to all the organs of the body. The same thing is going to happen. The systemic circulation will distribute this drug to all the organs in the body. Now, let us suppose to increase the absorption, I have made the drug lipid soluble. So, if this is a lipid soluble drug, first it will try to go into the organs or deposits in the organs which has more lipid content. Now, what is such an organ? Adipose tissue. So, yes, obviously it goes into adipose tissue and it goes into almost all the organs. Now, what are the important organs for us? That is what we are going to see now. So, let us suppose this is heart and let us suppose this is skeletal muscle. Now, the drug is going to all the organs, I accept. Now, the drug is also going into the heart. The drug will also go into the skeletal muscle. Yes. Now, on the heart, we have a receptor that is known as beta receptor. Again, on the skeletal muscle, we have a receptor that is beta receptor. Now, the most important concept that I want you to understand here, whatever effect you see in the body, it comes from the receptor. So, if you stimulate beta receptor, there will be increased heart rate. If you stimulate this beta receptor on the skeletal muscle, it will cause contractions. Yes, simple. Now, what I am saying is, when this drug propranolol comes here, this will block the beta receptors. So, if it blocks the beta receptor in the heart, it will decrease the heart rate. Now, if it blocks the beta receptor on the skeletal muscles, this will decrease the tremors. That's all. So, when you are decreasing the heart rate, it will decrease the blood pressure. It will also decrease the signs of anxiety. So, aren't you treating both anxiety and hypertension as well? Yes. So, that is why we are using propranolol. Now, which receptor are we blocking? We are blocking the beta receptor. That is why propranolol is also known as beta receptor. So, when are you getting the effect? The effect we are getting after the distribution. So, first there is absorption, then there is distribution. Now, after distribution, the drug is binding to the receptor and it causes effect. That's all. This is what has happened in the body. Now, think about it this way. Drug has caused the effect. Do you want the drug to stay on the receptor for a long period of time, or do you want the drug to come out of the body? Imagine. See, if the drug is staying on the receptor for a longer period of time, what will happen? Let us suppose in the heart, if it is blocking the beta receptors for a long period of time, heart rate will start decreasing. When it starts decreasing, if it is decreasing for a long period of time, the person might go into coma, the person might even die. So, this is causing toxicity. Do you want this toxicity to happen in the body? No. So, what should happen? The drug detaches from the receptor and it is excreted out from the body. Now, how do you excrete anything from the body, especially the main sources? Yes, you excrete things either through urine or feces. Now, what I am saying is, most of the drugs are excreted in urine through kidneys. So, it can be either from feces or urine, but mostly through kidneys in urine. That's all. So, let us suppose we have gotten the effect and now the drug is trying to excrete out of the body. Please don't write this down. Let us imagine if the drug is trying to be excreted from the body. Now, what is the functional unit of kidney? All of you must know this. Yes, functional unit of kidney is nephron. The nephron is made up of Bowman's capsule And in the Bowman's capsule, before coming into the Bowman's capsule, what is the filtration unit that is made up of blood vessels, afferent and different arterioles? What is it? It is glomerulus. So the drug comes into the glomerulus and the drug is filtered. This is what is filtration. Once it comes into the proximal convoluted tubule, now let me tell you, most of the filtrate is reabsorbed in the proximal convoluted tubule. Yes, most of it. Now, will the drug be reabsorbed as well? Do you accept that the proximal convoluted tubule is also made up of cells? These cells will also have cell membranes. These cell membranes are also made up of phospholipid bilayer with proteins in it. Now, our drug is lipid soluble or water soluble? Try to imagine. I gave you the example. We tried to make the drug more lipid soluble for increasing the absorption. Now, the drug is lipid soluble. If it is lipid soluble, obviously it will cross this membrane and be reabsorbed back into the systemic circulation. It will be reabsorbed back into the systemic circulation. Now, the drug in the body will increase. Is it being excreted? No. So, if you want to excrete the drug, do you want the drug to be lipid soluble or water soluble? Simple question. It should not be lipid soluble, then it should be water soluble. Now this is the problem. I've given a lipid soluble drug. Now I'm saying I want a water soluble drug. How is this possible? How is this possible? Think. With the help of the liver, that is what liver does. Liver converts this lipid soluble drug into the water soluble drug. Liver converts what? Lipid soluble drug into the water soluble drug. This is what is metabolism. So what is the main aim of metabolism? It first converts the lipid soluble drug into water soluble drug. So the drug passes through the liver, it gets converted into water soluble drug and then comes into the kidney. When it is water soluble, this will be excreted through kidney in the urine. This is what has happened. So what has happened? First is absorption, second is distribution. Next we have gotten the effect. Once you got the effect, the drug is metabolized. Now after metabolism, the drug is excreted. So most of the drugs will be excreted through kidneys in urine. Yes. Now some of the drugs, while they get metabolized in the liver, they might be secreted into the bile. Now bile will obviously opening into the intestine, and from the intestine it will be excreted in the feces. Yes, but the most common way is urine. I've already told you. So this is what is happening in the body when you give a drug. What are the absorption, distribution, then you've gotten the effect, then there is metabolism, then there is excretion. This is what you mug it up. You call it ADME, no, absorption, distribution, metabolism and excretion. But this is the beautiful concept behind this. Now, if you understood this much, let us try to see what are pharmacokinetics. See, kinetics means movement. Now, will you accept there is movement in absorption, distribution, metabolism and excretion? You have to. Why? In absorption it is moving from the intestine into the systemic circulation. During distribution it is moving everywhere. In the metabolism it is going into the liver, and in the excretion it is moving out through the urine. So there is movement. That is why pharmacokinetics are ADME. Now what is the definition for this? That is what we'll try to see. What is the definition? Is whatever body does to drug. Now what is body doing to the drug? You can see here, obviously body is absorbing the drug, body is distributing the drug, body is metabolizing the drug, body is excreting the drug. So whatever body does to the drug, that is what is pharmacokinetics. Now what are pharmacodynamics then? Dynamics, D for D, whatever drug does to the body. Whatever drug does to the body. What is drug doing to the body, you might ask me? See, the drug is binding to the receptor and this receptor is giving the effect. That is what is pharmacodynamics. That's all. You've gotten all the basics that are required for understanding the general pharmacology. Yes, you understood what are pharmacokinetics, what are pharmacodynamics. We just have to see the factors affecting them in general pharma, and you're done with general pharmacology. Yes, if you understood this much, what did you understand in the body, which is the most important thing? Yes, obviously it is a receptor. Because only when you stimulate the receptor, you get the effect. Now, receptors are many types. We have inotropic receptors, we have cytoplasmic receptors, we have nuclear receptors, we have metabotropic receptors. In all of this, the most important one that I want you to understand for pharmacology is metabotropic receptor, that is also known as GPCR. GPCR means G protein coupled receptor. Now, I am not going to tell you in a lot of detail, but what I want you to understand is GPCRs are three types. They are GS, GQ, GI. Now, when you activate these receptors, what are the functions that these receptors have? We will try to see that. Now, it is easier to remember it this way. GS is stimulatory, so it is stimulating muscles. Now, how many types of muscles do you have in body? Three types. What are they? I've already given you the hint. There are three types. What are they? Skeletal, will you accept? Cardiac and smooth muscle. Now, when you are stimulating the muscle, what will happen? Contraction or relaxation? Obviously, it should be contraction. So, it causes skeletal muscle contraction. It causes cardiac muscle contraction. But this is what is most important. It will cause smooth muscle relaxation. It will cause smooth muscle relaxation. Please remember this one point. GS is stimulatory. It will stimulate everything except for smooth muscle. That is about GS. Yes, please get this into your head. Yes, this is about GS. Now, coming to GI. GI is inhibitory. So, it will inhibit, that means it will relax all the muscles. So, it is relaxing skeletal muscles. Yes, it is relaxing cardiac muscle. Now, smooth muscle relaxation has already been done by the GS. What is left? What is left out? That is GQ. Now, what is GQ doing? See, whatever is left out. Is smooth muscle relaxed? Yes. Is smooth muscle contracted? No. So, that is what GQ will do. GQ will cause smooth muscle contraction. That's all. So, what did I ask you to remember? Just one point. GS will stimulate everything except for smooth muscle. Now, remaining muscles are inhibited by GI. What is left out? Smooth muscle contraction. This will be done by GQ. So, when you accept this, when you activate this GQ receptor, what will it cause? It will cause smooth muscle contraction. This much you understood? Yes. Now, after studying this, I just want you to remember the two types of drugs that are most commonly used in practice. What are these? They are agonist and antagonist. Now, what will agonist do? Agonist will directly bind to the receptor. Directly. It will directly bind to the receptor and it will activate the receptor and increase its effect. So, what is agonist doing? It is activating the receptor. What is antagonist doing? It is blocking the receptor. It blocks the receptor. Did you understand? That's all. So, agonist will activate the receptor, antagonist will block the receptor. So, there are two classes of drugs I want you to remember for now. Now, these antagonists are also known as blockers. We've already seen one example of this beta blocker is propranolol. So, this is what I want you to understand from these basics. What are these basics? I've already told you pharmacokinetics are ADME. Pharmacodynamics are drug binding to receptor to cause effect. Now, when do you get the effect? After absorption or distribution? Obviously, after distribution. Then I told you about the receptors GS, GQ and GI. GS will stimulate everything except for smooth muscle. GI will relax the remaining muscles. GQ will contract the smooth muscle. Now, agonist is binding to the receptor and activating the receptor. Antagonist is blocking the receptor. That's all. So, if you understood this much,